Good afternoon, everyone. I would like to talk about my upcoming research study with NFORC on managing facial lacerations in children. These are common and can be very challenging to treat, as the child is often upset and in pain, and the parents are very distressed and want the best outcome for their children. There are several methods of treating facial lacerations. However, there is no consensus on what is the ideal treatment. Here are some of the commonly used methods at present. For the more superficial wound, we can use medical surgical glue or adhesive tapes, but for the deeper wound, stitches provide a more accurate result with the best long-term cosmetic outcome. This is a 3-year-old boy who was sitting on the front seat of a car with his seatbelt on when his gran, who was driving, lost control and the car rolled over. He was concussed and the windscreen shattered, leaving him with a nasty forehead laceration with bits of glass embedded in the wound, which you can see up here on the CT scan. He had to have a general anesthetic to have his laceration fixed and all the glass bits removed from his wound. The ragged laceration was stitched using soluble stitches in this case, and here's the result just 2 weeks after the operation. We expect further improvement to occur. Poorly treated facial lacerations can lead to serious complications which can be permanently disfiguring for a child. Here are a few examples. This is a widened scar. This is what we call as a heaped up keloid scar. And this little boy, unfortunately, developed a wound infection, which is going to heal with even more scarring than normal. So my research project with NFORC is to see if we can find the ideal treatment for these children in order to provide good cosmetic results, but with as little stress as possible. So we're going to compare using a non-dissolving stitch against a dissolving stitch to fix these cuts on children. The non-dissolving stitch needs to be removed in 5 days, and children who are young and uncooperative need sedation, or sometimes, worse still, even a second general anesthetic procedure to have these stitches removed. The dissolving stitches, on the other hand, do not require a second procedure, but we are yet to prove if they are as good as, or maybe even better, than the more commonly used non-dissolving stitch. So this research study with NFORC will hopefully help us answer these questions with a view to providing national guidance on how they are best managed. Thank you very much.
My name's Clio, and I'm Professor Hutchison's daughter, but I'm not talking in that capacity right now. I'm not a patient, but I have been present for a lot of head injuries. Maybe I'm a bad omen or something. Particularly of my younger brother, who, when we were kids, was very accident-prone and a bit of a wild child. In fact, we actually, a few years ago, he shaved his head, and we discovered a whole load of scars underneath his hair that none of us had realised were there. But one particular memory that I have is of him in the school playground during a game of tag, trying to escape and leaping over a bench, at which point he caught his foot on the bench. So nothing quite as serious as the injuries that have been shown here, but of course with children, injuries can seem so much more serious, especially head injuries where there can be what seems like a lot of blood. And for the non-medic or non-medical professional, it can be very shocking. So at that point, all the children in the playground gathered round, wanted to take a good look. Voyeurism starts at a young age, it seems. So he was lying on the floor, pool of blood, and was taken off to the hospital. And the last thing I saw when I was asked to come and help sort of take him to the hospital was all the children crying around him from his class, particularly the girl who'd been chasing him, who believed she'd killed him. And of course, he was maybe age 6, so I was about age 8. So I also thought that she'd killed him. And as much as we have sibling rivalry, I was definitely a little angry that this person had taken my best buddy away from me. But it turned out he was fine. He had a little glue on his stitch, the gravel removed, and it was all okay. However, I suppose the point of this is, and asking me to come up and talk, is about how when we see a head injury, it can be really shocking, the amount of blood. And especially, there are a lot of blood vessels really on the surface in the head, and so it is very, very scary. So I think that's my main reason for being up here, is to talk about that and how, actually with all kind of medical issues, when there's blood flowing, it can seem like a lot more than it actually is. But I suppose we always have to take a step back and deal with it in a professional way. So I think that might be part of the reason why I've decided now to go into medicine and follow in my father's footsteps. So thank you.
Well done, Clio. The story. So you've heard it from a child's perspective. I want to tell you the story from an adult perspective. So there's another accident. You heard he was accident prone, and I think and Clio was present at that, and I'm not sure how old he was then in Scotland when he fell over, and he had what appeared to be a cleft lip. He fell over, hit a stone. And I wasn't in Scotland, my wife was in Scotland with him, and I had this phone call. Her handsome young son was going to be scarred for life with his cleft lip. And so a professional woman, who's well known, wasn't able to cope with this. So children's scars are worrying to parents, children, anybody who's around, and it's important to treat them well with as little pain as possible, and that's why this research is going to be so important. It may seem so simple, and that's what a lot of this research is about. It may seem very simple, but it's research that hasn't been done yet and needs to be done.